Osteoarthritis, or OA, is a chronic condition that causes joint pain and limits mobility, especially among middle-aged and older adults. It's surprisingly common in people living with type 2 diabetes mellitus (TDM), a disease affecting 1 in 9 adults worldwide. Managing diabetes relies heavily on keeping blood sugar levels in check, but when knee OA is present, it can make self-management much harder. Scene sets the stage by highlighting how OA and TDM often coexist, creating a cycle where joint pain and mobility issues become barriers to effective diabetes care. The study we're exploring today investigates whether having symptomatic knee OA actually impacts glycemic control, which is crucial for preventing diabetes complications. Let's dive deeper into how these two conditions interact and why this matters for patient outcome. Researchers recruited 351 individuals with T2DM, all aged 45 or older, from diabetes clinics in Canada. Participants completed detailed questionnaires about their demographics, medical history, and knee symptoms. Glycemic control was measured using HbA1c levels with a target set at 7% or lower. Symptomatic knee OA was defined by specific clinical criteria, and pain severity was rated on a scale from 0 to 100. The study found that nearly 29% of participants had knee OA, and those with OA were less likely to reach their glycemic targets. Notably, individuals with painful knee OA, pain greater or equal to 20/100, were about 40% less likely to achieve target glycemic control, even after adjusting for age, gender, education, and BMI. These results suggest a direct link between OA symptoms and diabetes management, emphasizing the need for integrated care. How does knee OA affect diabetes control? The study points to several mechanisms. Pain and mobility limitations from OA often lead to physical inactivity, which reduces muscle glucose uptake and worsens blood sugar control. Additionally, oil-related pain can trigger stress hormones that increase insulin resistance. Depression, fatigue, and poor sleep, more common in those with OA, further complicate diabetes management. Findings underscore that OA is not just a joint problem. It can be a modifiable risk factor for diabetes complications. Clinicians should recognize OA symptoms as barriers to glycemic control and consider integrated strategies that address both conditions. Future research is needed to confirm these results and develop interventions that improve outcomes for people living with both knee OA and T2DM. Summary: the study reveals that symptomatic knee OA, especially when painful, is linked to poorer glycemic control in people with type 2 diabetes. This relationship highlights the importance of recognizing OA as a barrier to diabetes management and suggests that improving arthritis care could help more patients reach their blood sugar targets. The research encourages larger future studies to confirm these findings and explore new ways to integrate OA and diabetes care. By addressing both conditions together, healthcare providers can help reduce the risk of diabetes complications and improve quality of life for affected individuals. The journey toward better outcomes starts with understanding the interplay between chronic pain and chronic disease.